Learning Plan 20, Sharpen Dental Instruments. Learning objectives. Identify the advantages of sharp instruments. Identify safety and infection control protocol when sharpening instruments, including when and where instruments are sharpened. Identify the armamentarium for sharpening. Illumination, non-frosty test stick, ceramic sharpening stone, cup of water, and gauze squares. Discuss type, care, and lubrication of sharpening stones and acrylic test stick according to Darby and Walsh. Assess sharpness of the cutting edge using the glare technique and/or acrylic test stick. Describe the essential differences between the technique of moving the instrument or moving the stone according to Darby and Walsh. Describe the instrument sharpening according to LP20 using the moving stone technique and the evaluation sheet. Describe the instrument design to be maintained, shape of the cutting edge, and internal angles according to Garrett, Srota, and Sakuzo, fundamentals of periodontal instrumentation, and Darby and Walsh. Advantages of sharp instruments are reduced operating time and clinician fatigue, increased effectiveness of instrumentation, increased patient comfort from reduced pressure and number of strokes to remove calculus deposits. More advantages of sharp instruments include reduced trauma to tooth and tissue, tactile sense is increased, and therapeutic value of instrumentation is increased. Disadvantages of dull instruments are increased fatigue and time, ineffective instrumentation, increased number of strokes and pressure needed to remove calculus, which means decreased comfort of the patient. Other disadvantages of dull instruments include chance of trauma to tissue and tooth is increased, tactile sense is decreased, and the therapeutic value of instrumentation is lessened. Only sterilized instruments should be sharpened for the safety of the clinician to avoid accidental injury during sharpening of a non-sterile instrument. However, there may be times when it is necessary to sharpen an instrument during an appointment. Use extreme caution when sharpening non-sterile instruments. Supplies you will need for sharpening include dull instruments, synthetic ceramic stone, acrylic test stick, magnification, illumination, lubricant, 2x2 gauze squares, gloves, safety glasses, and a mask. Sharpening stones can be natural or synthetic, and lubricants can be water or oil, or both, depending on the type of stone. There are a variety of shapes and sizes of stones. Moving the instrument technique is where the instrument is moved over the stone. Darby and Walsh recommend this technique for sickle scalers. A special tool called a sharpening horse can be used with this technique. MATC teaches the stabilized instrument and moving stone technique, where the sharpening stone is moved over the lateral surfaces of a stabilized instrument. According to Darby and Walsh, this is the recommended technique for sharpening curettes. Assess sharpness both before and after sharpening. The glare test or the acrylic test stick is used to assess instrument sharpness or dullness. Using a saliva ejector is not recommended, but it can be used in an emergency. During your sharpening evaluation, you will use the glare test and the acrylic test stick. During the glare test, a sharp edge will be dark as it does not reflect the light, while a sharp edge will appear white or silver as it reflects the light. The test stick should be clear and not cloudy or frosty or be heavily scratched. Use a modified pen grasp with a fulcrum on the finger holding the stick with the toe or the tip facing towards or away from you. Scalers and universal curettes lean into the test stick at 11 o'clock or 1 o'clock position to maintain a 45 to 90 degree angle of the cutting edge to the stick, while Gracie or area-specific curette will be parallel at a 12 o'clock position since the angle of the lower cutting edge is offset. Either the instrument or the stick is rolled to engage the cutting edge to assess sharpness or dullness from heel to tip or toe while using light upward pressure. Beware of online videos that demonstrate heavy pressure to produce a sound to determine sharpness. With light pressure, a sharp cutting edge grabs the stick, and a dull cutting edge slides off the stick. When heavy pressure is applied, even a dull edge can grab the acrylic stick. The steps of the stabilized instrument and moving stone sharpening technique begin with verification that the instrument is dull. The glare test and acrylic test stick are used to assess instrument sharpness or dullness of the entire cutting edge. Adjust overhead light for maximum illumination of the instrument face and the cutting edges. The instrument is stabilized by the countertop, as is the hand and or arm. Make sure the handle or the shank of the instrument also rests against the edge or the side of the countertop. It is not necessary to place your thumb against the shank as we see in our textbook. The face is positioned parallel to the floor or the countertop. Look at the position of the face and terminal shank of the Gracie curette once the face is parallel to the countertop. Remember that an area-specific curette has one lower cutting edge that is offset. Therefore, when the face is parallel to the countertop, the terminal shank will not be perpendicular, as it is with scalers and universal curettes. The synthetic ceramic stone is lubricated with water. Excess water is blotted on gauze squares or paper towel. For safe and effective movement, grasp the stone so that your fingers are not in the way of the instrument. Choose from 3 different grasps to decide what feels most comfortable for you. Place the stone at a 90-degree angle to the face of the instrument. Adjust the stone for sharpening by opening the angle to the face from 90 degrees to 100 to 110 degrees, or the 11 or 1 o'clock position. The angle tilt of the stone plus the internal angle maintains the original design of the cutting edge for a total of 180 degrees. Sharpen the entire cutting edge from heel 1/3 to middle 1/3 to tip or toe 1/3, and then rounding the toe of a curette. MATC does not contour the back of the instrument as is demonstrated in the textbook. If the stone slips during the sharpening process, restart sharpening at the heel to ensure even sharpening of the entire cutting edge. The pressure used with the stone to the instrument during sharpening should be light enough that someone could easily take the stone out of your hand. No death grips. Begin with an upward stroke and always end on a downstroke to remove metal burrs from the cutting edge. Rotate the stone as you maintain a 100 to 110 degree angle of the stone to the face throughout the sharpening process. Begin at the outside surface of the cutting edge, rotate the stone around the toe while maintaining the 100 to 110 degree angle. By leaning forward at your waist, you can see over the stone. Continue to the inside surface of the cutting edge to end on a downward stroke. If the toe of a curette isn't rounded, you will turn your curette into a scaler, as the toe will become a pointed tip instead of a rounded toe. The angle of the stone will need to be maintained at that 100 to 110 degrees to the face of the instrument throughout the sharpening process. Hone the face of the instrument after sharpening the cutting edges. Place the sharpening stone parallel and horizontal to the instrument face. Sweep the stone across the entire face of the instrument, simultaneously turning your wrist upwards and towards you. Verify the sharpness of the entire cutting edge of the instrument with the acrylic test stick using light upward pressure. If the instrument does not grab the stick, resharpen the entire cutting edge as necessary to preserve the instrument design from heel third, middle third, tip third, or toe third, and then you will round the toe if it's a curette. To care for the stone and the test stick, place both within the cassette. Ultrasonically clean the cassette, remove the cassette from the ultrasonic, and rinse. Open the cassette and remove the test stick. Put the stick in a properly labeled ProView bag to be sterilized. The stone remains within the cassette to be sterilized. Do not reuse IMS wrap to sterilize the cassette. Sharpening lateral surfaces of instruments is the preferred technique to maintain shape and strength for longer. Scalers and universal curettes have 4 cutting edges, inside and outside on each end of the instrument. Gracie or area-specific curettes have only 1 lower cutting edge on each end of the instrument. Sharpen around the toe of all curettes. Do not sharpen the face of the instrument routinely, as this will weaken instrument design. Sharpening the face is different than honing the face. Knowledge of the precise design characteristics of scalers and curettes is necessary for correct sharpening technique to preserve and maintain instrument design for safe and effective calculus removal. The cross-section design of a scaler is triangular in shape, while a curette is semicircular in shape. Visualize the working end and cross-section to understand the 70 to 80 degrees of internal angles for scalers and curettes formed by the face and lateral surfaces. Look down on the face to see and verify lateral surface design. Is it curved or straight? Notice the difference in shape between the scalars. One is more tapered, while the other is more arrow-shaped, as is true with the different working ends of the SH533. Notice the difference in shape of the curettes. One is more curved than the other, like the SYG78 Universal compared to the 3-4 Gracie. To restore a sharp cutting edge, first visualize the working end in cross-section to understand the shape of the instrument. Then visualize the internal angles formed by instrument face and lateral surfaces, initial placement of the stone to the face, and the adjustment and maintenance of the angle of the stone to the face. Only remove a small amount of metal to restore the cutting edge. Remember that every time you move the stone against the instrument, you are removing metal. Be careful not to over-sharpen. Use light pressure and focus on the angles of the instrument. Preservation of the angles is important because there is an increased potential for instrument breakage when the internal angle is less than 70 degrees, because the instrument will become very thin, worn down, and dull. When internal angle is greater than 90 degrees, the lateral surfaces or cutting edges have been removed, creating a bulky working end that is difficult to adapt. Therefore, it is ineffective at removing calculus. Increased patient discomfort results as heavy lateral pressure is applied to try to remove calculus deposits. Over or under angulation of the sharpening stone to the cutting edges, not rounding the toe, and over sharpening can significantly alter instrument design characteristics and affect the ability of the instrument to effectively remove calculus. Do not practice sharpening at home prior to your practice session in clinic. If you damage your instruments by using an incorrect sharpening technique, you will need to buy new replacement instruments. Please watch the sharpening videos next. While they are not perfect, use them for guidance before you practice sharpening instruments in clinic.